Hello and welcome to Wellness Diaries on Top Joyful Talks TV. How are you doing? I believe and hope you are doing very great. You are doing fine. On Top Wellness Diaries, we try to talk about so many health challenges, so many health issues that a lot of people go through, and we also try to give correct insights, correct information, we go help young people take a better seriously in this part of the world. And when person don dey sick sotey e don reach time wey I no want use a bad language now when e don reach say e be like say something wan happen to you, na that time na im people dey know say they go hospital, but e no suppose be like that. So on Top Wellness Diaries, we talk about all these different health issues, health matters dem, bring correct professionals to talk about some of them so that una go take better decision when it comes to your health. If you never subscribe to my channel, please subscribe to Talk TV and share the link. Somebody fit wan watch wetin we dey talk about today. You fit be savior for somebody, you never can tell. So share the link and invite someone to join us. This is what we do every Sunday on Top Wellness Diaries. Today we want to talk about patient safety. Patient safety. A lot of people, I don hear a lot of things, and I don also see a lot of mistakes here and there. Somebody go hospital, you go do test. I don see person wey do genotype test, dey tell am say im be AA, meanwhile na AS im be. Im go marry person wey also be AS. As dey born pikin now, dey born SS. So na that one na wetin the mistake wey dem for fit avoid if to say the doctor no make mistake, or the lab scientist no make mistake. And at the end of the day, na the patient na im dey get the gbas, na im dey get the hammer at the end of the day. So that's why I bring this topic come today. And today I have somebody wey go help us touchlight this matter. Im name na Dr. Chukwuemeka Anthony Agwuodo. Is his first time on Wellness Diaries today, but I go like make you give me little time to read his profile sometimes, because na their hard work. E no easy to go through. If they tell you how much they spend to acquire all these things, you go know say e dey very important. Talk about it and we blow their trumpet. So Dr. Chukwuemeka is a compassionate medical professional. When I hear this compassionate, I say okay. Say some doctors they wicked. So but this one na compassionate. Is a compassionate, meaning say if this so he's a compassionate medical laboratory scientist, a skilled is an extensive experience in homeopathy, hematology and blood transfusion services, proven track records of providing exceptional care and support to vulnerable population. He possesses strong technical skills, attention to details, and excellent communication ability. So attention to details, now that one now it strike me. Attention to a lot of people, a lot of doctors don't pay attention to details. They just feel So thank you so much for joining us today on Wellness Diaries, Dr. Chukwuemeka. How are you doing, sir?
I am doing very well. Thank you so much for bringing me on board here. Thank you. I appreciate.
You're welcome. You're welcome. I appreciate you. So make we no waste plenty time. I hope say you go fit crack pidgin o. This na pidgin program.
Let's see how it goes.
All right. Make we no waste plenty time. Make we talk about this issue. Last month, that's in the month of September, was Patient Safety Day, World Patient Safety Day. I really want us to talk about it because I don't see people whereby because of one mistake of one nurse or one doctor. I don't see a lot of people go through life challenge, in fact, serious medical issue. One mistake where doctor make. So please make you help us touchlight the matter. What is patient safety? Why is it a topic for us to discuss? Hello, sir. Can you hear me?
Okay, thank you very much.
All right.
Yeah, I can hear you.
Yeah.
Yeah, thank you very much. You see, from the word, I go to combine them, like you said, is a pigeon program. I go to
No,
combine them,
no
yeah, so that
wahala,
I will
carry go.
blend in the thing.
Carry
And
go.
so when you talk about patience and
Mm,
safety,
mm,
do you understand?
mm,
From the word safe,
mm,
that's where the safety was drawn from. So this World Patients Safety Day is being celebrated globally.
mm,
Now the day where the World Health Organization
yeah.
bring globally to raise awareness campaign on the patients and their safety, and also to encourage the collaboration among patients, the health workers,
Mm,
the leaders, all in the bid to make we join hands to improve patient safety. So
mm,
it's like encouraging both the patients, both the health workers, both the government. Is a campaign where they talk about both, they are talking to both the government, both the patients. You have collaboration among the three to
mm,
raise awareness for people to know wetin patient safety means. It is important. It is that this matter, this topic
mm,
should get down to the grassroots for people to know that their safety is of paramount importance, not only to you but to your dependents, but to the and also to the government, because the government needs you, your children needs you,
mm.
the community is to bring to your knowledge, make we bring the knowledge to your doorstep. Say you have to be aware that we are propagating, we are taking this thing globally, so that you should be conscious of your safety. Now wetin World Patients Safety Day means.
Okay, so for the this year's theme, focus on newborn, you know,
Yeah.
maybe because they are vulnerable, they can't help themselves. So the this year's theme focuses on newborn, you know. So the next question wey I wan ask now be say, what are the most common causes of harm to patients? You know, the most common harm to patients in healthcare settings. Wetin be the most, I don paint one scenario wey I don witness. This one na I see am, no be say dey tell me, you know, where somebody
Yeah.
go do test, dey tell am say im blood group, im dey do
Group na,
say na AA, and im dey
yeah,
find im, you know say person wey be AA,
if he
meanwhile
marry, yes,
if he marry anybody, so im
yes,
husband do too, dey tell am say na AA abi na AS. As dey
yeah,
go do the marriage finish, dey born pikin na SS. Dey come dey wonder wetin happen, only for dem to find out say dey make mistake for the result wey dey, and this been done. There's no way pikin wey don come life now, there's no way, so that pikin go dey permanently, you know, into pain. So how, you know, I want you to explain better what are the most common causes of harm to patient. Now one scenario be this wey I don pay, wetin be other ones wey you fit share with us?
okay, okay. It is important we all listen to this so that we get the most common errors,
Mm,
that could cause what you just explain now.
mm,
One, for the maternal, now medication error.
mm,
We can have what we call medication error,
mm,
where the maybe incorrect dosing, you are supposed to give the patient 500 milligram,
mm,
but you made a mistake, or the patient or the pharmacist that dispensed the medication didn't go through well, and instead of giving the patient 500 milligram, he go give the patient 250 milligram.
mm,
And the doctor will give 500 milligram, get reason why he give 500 milligram at for so time in a day,
mm.
times number of days in a week. But maybe the patient made mistake, go they break am.
The pharmacist.
or the pharmacist. Maybe the pharmacist made mistake, go dispense
More than the doctor
the
has
lower
written.
dose.
Mm.
Meanwhile, the doctor has written so dose. Do you understand? That is just one. Then we also have diagnostic error. Diagnostic error could also come from the medical laboratory sections or the doctor himself. That the doctor is thinking that this, that it is another error. So when we have delayed or incorrect diagnosis, it could lead to improper treatment and harm. When the diagnosis is not well done, it will definitely turn out to give a wrong treatment to the patient.
Good. The reason why I ask you that question be say, I know say you be a lab scientist, and you
Yes.
also don do courses as regards to blood transfusion and stuff like that. So na im make me ask you that question, because I know say e get some people wey be say dey sick, dey carry themselves go hospital, dey run test finish, dey tell dem say na cancer you get o, meanwhile na ordinary malaria
Wey im get.
na im get, and e come dey take medication for cancer. Meanwhile no be wetin dey worry am be that. I don see a lot of people, go through all these things, and at the end of the day na the patient na im dey suffer.
Yes.
So now, how do this kind of things now when e happen, how do this systematic issue like misdiagnosis and or wrong medications impact on the patient? At the end of the day, wetin dey happen?
Now, because of that wrong diagnosis that has been generated, or maybe wrong dosing, or maybe equipment error, it could now lead to increased morbidity or mortality rate. See, wrong diagnosis could be very, very dangerous. It could be very, very dangerous. It could also cause prolonged hospital stay because of the wrong diagnosis. Because of the wrong diagnosis, it could lead to the patient now staying longer than he or she could in the hospital. And that could also cause what we call emotional trauma. Because the patient has overstayed. The patient is seeing a whole lot of things because as a result of the wrong diagnosis, is now giving the patient the emotional trauma that the patient is not supposed to be experiencing. So these are some of the things that could, as in the systemic issues that could arise as a result of the wrong diagnosis,
Patient
where because of the wrong patient fit now stay because the diagnosis is wrong. Do you understand? Now, by the time they could realize that this is a mistake from whoever that made it, the patient has overstayed. You understand? Now, incurring even deaths, incurring psychological and emotional trauma.
na wetin I want
Do you understand? So this thing begins to, yes, in this beautiful economy. And because of that, we couldn't also rule out the increased morbidity rate. Yes. So these among others could also happen as a result of wrong diagnosis.
So
That's why
go ahead.
for most of us in the medical profession, we are very specific and particular about it. See, for me, when you as a physician is attending to a patient, I had been advocating that you pay holistic and 100% attention to the patient. Because when you hear out the patient, when you understand the root cause of the patient's problem, that will also help you to it will give you an informed decision on the diagnosis you will make. Because just like we were told, if you don't count one, you cannot count three.
Exactly.
You understand? So if you jump this, it will give you the two that you are trying to enter will be wrong.
Yeah.
So precise and exact diagnosis is the key, because its after effects like it could also lead to death. Basically, yes.
Thank you so much, doctor. So Now we don't talk about the impact on the patient. So now let us try and see if solution, because when you know that this, if you continue to do this way, that these are the things you will get at the end of the day, and we know that the result is always, you know, people get to a sorry, they begin to apologize, we are sorry. If it's in the case of death, the person had already, so you know, you keep apologizing to families and all that. Now how can health care workers
Yeah.
be better trained to avoid all this, will I even call him little mistake? It's not a little mistake. How can they be better trained to avoid all these huge mistake that can cause someone, you know, maybe death or permanently ill for the rest of his or her life? What you dey suggest? How
Okay.
the nurses, the doctors, how
Waiting
can
I
they be
dis
better
waiting
trained?
I dey suggest.
Mm,
Okay, waiting I dey suggest be say, you know, in health,
mm,
in the health profession, you need to be updated day to day.
mm,
You need to be updated day to day. So there is what we call specialized training.
mm,
Is very, very important. We do for all health professionals, we do specialized training for them. Do you understand?
yeah.
Whereby they go for workshops, whereby they go for trainings,
Mm,
whereby they go for seminars, update courses.
mm,
Throw yourself down to the unit where you work, to the unit where you consult, you will be blindfolded. You need to go out, you need to read, you need to go and meet your other professional colleagues and also see maybe some cases that is peculiar with their area. So
mm,
you do what we call an update course, you go to training, you go to seminars. So those things will help you to get informed, to get abreast with the current trend in medicine.
mm,
Do you understand? So
yeah.
there should also be collaboration and communication among the health workers. When we say the doctors, the pharmacists, the medical lab scientists, all health workers that are involved in saving lives should be updating him or herself. There should be collaboration between a medical doctor, between a pharmacist, between a medical laboratory scientist, between a physiotherapist, even between a dietitian, so that if there is no collaboration, it will not give out the expected results. You
Mm,
know, our aim at the end of the whole thing is to get the patient to start doing well.
well.
That is the aim of every health professional. So when you work in isolation, believe me, you cannot get result. That is why I said that collaboration and communication is key.
Hmm.
And there is also this simulation-based education where you, from time to time, go online to also read some cases,
Hmm.
come together between you and your colleagues to also do some, we call it case reviews. Do you understand?
Yeah.
So these, among other specialized trainings, will help the healthcare professionals, the healthcare practitioners to be abreast, to understand, because you see, we have individual differences. Psychological medicine will even tell you that you have to understand the patient and take out the factors, we call it to health. Those factors that are inhibiting healing should be expunged, it should be removed. So when you also do a collaborative studies, you understand how this patient was taken care of by this doctor in this community, in this area.
Hmm.
Do you understand?
Yeah.
That's where communication and collaboration now comes in. So you adopt it and get it incorporated into your own knowledge. Now, you've tried this medically, it didn't work. You bring in that psychological medicine as well to also see if it works. So with that, your end point, which is saving the patient, will be actualized.
Hmm. Thank you so much, Dr. Emeka. This is Wellness Diaries on Top Joyful Talks TV. If you are just joining us, you have missed, but you can still catch up a little. We've been talking about patient safety as we join the rest of the world to celebrate World Patient Safety Day. It's very important. A lot of people don't go because of one mistake of one doctor or nurse or the other. They come back to tell your family, look at childbirth. So a woman carry child for 9 months, and at the end of the day they begin tell you story, say one thing one happen. It's heartbreaking, and that is why it's important for us to talk about it, so that we go understand how these things work. So doctor, thank you so much for throwing more light on the health system and all whatnot. Now, the next question wey I wan ask na, wetin be the role of technology in these things? Because I don hear say e get one machine when you go enter inside, e go tell you your life history, tell you about you no even need, just enter the machine and come, e go dey sorted. So please throw more light on that one too, because people need to understand the role of technology in all of this.
Okay, thank you very much. The role of technology has come to stay, and we have to embrace it. Even in the health sector, we no go fit push am away. It has come, and it's very helpful. Do you understand? So we have what we call digital records.
Okay.
Do you understand? In my facility, for example, I give kudos to the chief medical director, where he has embraced the current technology, where we have digital records. Do you understand? We also have clinical decision support system. These, among others, could are where the technology has come in. Now, we also have electronic prescribing. Let me be explaining. I said electronic prescribing. I said digital records. Back in the days, you go to hospital, you see them carrying folders, carrying files. You come as early as 8 a.m., they tell you they are still looking for your folder. When technology has brought in computer, when you just click in the patient's name and maybe his ID as you saved it in your system with, it brings out the whole records about the patient. So even if the folder, maybe those in the medical records that brings out the folder, they are delayed, you click in at that digital record, it brings out the patient's details, and you know where you stopped, the medications you gave, everything, one touch, everything is in there in the system. So from there you fire down. From there you go begin give out the drugs. Also, we looked at electronic prescribing. All those the electronic errors as well. You understand? Technology has really made it much easier. Those errors that is associated with handwritten. Do you understand? Where I'm not seeing the doctor's handwriting. They will always castigate us that our handwritings are not visible.
In fact,
You know,
all the jaga jaga, we no dey understand them.
they will tell us that our handwriting are not visible. Now, because of that, with the aid of the electronic prescribing, you can now
See very
eligibly
well.
see the handwriting of the doctor. So the doctor that wrote gets amyloid has written it, and he knew what he wrote because of what he saw. Now, because you didn't see his handwriting, you went and bought amitriptyline. These are two different medications. So that, yes, these are two different medications that electronic prescribing will reduce or has reduced. Do you understand?
Yeah.
So you don't have any excuse to go and buy what was not prescribed to you by the doctor. You don't have any excuse that you came since 8 a.m. and that they are saying they are looking for your folder. You don't need folder. You do digital reports. Do you understand? Now, these are electronic ways of, we electronically call you to remind you of your appointment. done in the unit where I work now. So if you have an appointment with a doctor, we will send you a message that your appointment is due for so day. So that is these are what technology has brought to also help alleviate the stress that is being undergone by patients.
Thank you, sir. Thank you so much. But I know say everything wey get advantage also get disadvantage. So this one no get disadvantage. Technology, if you no fit fail, what are the possible disadvantage that you can see?
Okay, now that is why I tell people there is always a first day. The possible disadvantage is you just started working in a facility and you don't know how to use those like the electronic prescribing, don't know how to do the digital recording. You do what? You ask questions. Do you understand? You ask questions. When you ask questions, you will be tutored on how to do this. Of course, you are not a dunce. You already know your left from your right.
Yeah.
So asking questions will help. Now, another disadvantage in it is that just like computer, garbage in, garbage out. Let me tell you a story I had in the same facility where I worked. The person that keyed in the information about me, for example, keyed in, assuming my age is 10 years, the person went and keyed in 35 years for me.
Whoa.
So now this thing needs to be verified again. In the unit where I work, it's the laboratory, for example. Once you are done with your laboratory investigations, you have someone that supervises a colleague, a senior medical lab scientist, for example, that will also come and recheck what you did. Now, when you upload it in the system, there's another person that recheck. Are ways to checkmate those technological innovations. So the disadvantages is when those things are not put in place, when they are not being checkmated, when they are not being cross-checked, you could give out, because it's garbage in, garbage out. What you put in the computer is what you will definitely plug out when you want to receive it. So those things needs to be rechecked. But when you don't have someone that does that, it will harm it. It will harm your efficacy. Then another one is because of the digitalization, it will also reduce manpower. Because computer, we know we do the work of 3 persons within a twinkle of an eye.
Yeah.
So it will definitely reduce the manpower and displace some people from job. But we still not will say because it will displace some people in job, let's not embrace technology. No, it is
Thank you
its
so much.
advantages is far more bigger than its disadvantages.
Thank you so much. I really, really appreciate you. But before
Thank
we
you.
go, I have 2 more questions for you. Because we
Okay.
talk about patient safety, and the focus for this year is on newborn. I know that in the villages, in the rural areas, you see some auxiliary nurse, you see some, they call them midwife. They say, they help to dey deliver babies. They don't learn am. Na part of their job. And a lot of sometimes it works out. You see them, you see them do these things, and they deliver babies, and you see it work out. But other times you see people die in the hands of these women who claimed to be midwives, that they learnt it. They didn't go to school. They just, learnt how to do it. So what is your advice? How can, governments really look into people, women in the rural areas, to checkmate all this harm? Because at the end of the day, na the patient na im go suffer.
Thank you very much. My advice on that, you see, most of most of what we do, or some of what we do in the medical profession, you can say you are watching us maybe as a technician. You watch us clerk a patient. You watch us do some laboratory investigations. You watch us do this and you watch us do that over a period of time that you've learned it and you can do it. That is what is obtainable there in the rural area that you just cited. Those auxiliary nurses, maybe they have worked in the maternity or the A&C department in a teaching hospital, in a specialty hospital, and they have watched it over years. So they feel they can now do it. Do you understand?
Yeah.
Now, you can do it because you've watched. But when there is complication, that is when your professionalism now comes in play. And by that time, you cannot be there to save the situation. That is where the professional now comes in play. Now, my advice, like you rightly asked, is that the government should also support these people. The government should also assist them. The government should also employ a physician trained also be supervising what they do. The government should also assist them to go and obtain the proper training and certificate to be able to beat their chest and say, yes, that I can do this conscientiously, that yes, that I have passed through this training. Because no matter how you watch a medical doctor in the theater do the surgery, no matter how you watch him or her clerk a patient, no matter how you watch him or her do his prescription, no matter how you watch a scientist do his laboratory investigation, there are some areas, there are some points, at some points, he will now bring out his professionalism. Because, see, when you look at every urine sample, for example, and in every urine sample, you are seeing protein in the urinalysis. It cannot be correct. You look at 30 samples and you are seeing protein positive, protein positive. A trained, licensed, certified medical laboratory scientist will do his quality control immediately. But someone that is not trained, that is not certified, will continue. That's the way. So the government should help them get the proper training and certification. One, the government could also put in a professional that is certified, because it may be challenging for government to be everywhere when it comes to asking this person that is in this hall doing this practice, this person that is, but when the government now makes the education on what affordable, assist them, because they are already at the verge of getting those certification. You assist them to do that, or you post someone that is certified, someone that is properly trained to also watch over in the in the spirit of still saving lives, to play a supervisory role to those stations to ensure that quackery are not being practiced there, to
Thank
ensure
you.
that life are not being played with or gambled with.
Thank
That will also encourage them. That will also give credence to them in what they do.
Thank
Thank you.
you, Sam. Thank you so much. I want us to say, make you give advice to any health worker that is watching us, but you don't already talk and finish. You don't talk and we've been talking with Dr. Chukwuemeka Anthony Agodo. He's a medical practitioner, he's a medical professional and medical laboratory scientist. So we don't make mistake to carry and come today on top of this topic, and he's also a compassionate medical doctor. Now that one I get me. He's well experienced in 20 years of experience na im carry come. He's a hematology and blood transfusion services. He's with providing a special exceptional care and support to vulnerable population. He possesses strong technical skills, attention to details, and excellent communication ability. So if you wan go hospital, abeg submit yourself to a doctor wey dey pay at ten tion to details. No just carry yourself go meet any doctor wey go just tear your belle, after the wound, leave one scissors, leave one thing or the other inside your body, and in few years to come they go tell you say na mistake. When at the end of the day na patient na im go still suffer. That's why e dey pain me, and na im make me carry this topic come today on top of wellness diaries. Thank you so much, Dr. Chukwuemeka. Thank you for your time. I hope when next I call you, you will not hesitate to come.
I assure you, I will be very much willing and ready to come to this program any other day, any other time you call me.
Thank you
I
so
appreciate
much.
it because I am passionate about healthcare. I am so passionate about healthcare. I don't joke because you see, your health is your wealth, and I always try to give attention to any health related matters.
Thank you
Thank you
so
so much.
much. Thank you. I appreciate. So this is Wellness Diaries on Top Joyful Talk TV. So we do this every Sunday. Do well to subscribe to my channel at Joyful Talk TV. You can send the link. Somebody may want to, be in need of this particular episode. So watch the previous episode and get correct information, correct insight. We will help you take a better decision when it comes to your health. Till we see next week. Bye for now.
Bye. Thank you.